All right, how's it going, everybody? So today's video is going to be about vitamin D. So what is vitamin D? Well, vitamin D is not necessarily a vitamin. It's more like a hormone. It's a precursor hormone. So what a hormone is, it's a chemical messenger inside your body. So basically what that does, it regulates the normal growth of your cells. Okay, it's really critical. Vitamin D is very critical for healthy cell function. And when I talk about regulating normal growth of cells, what I'm talking about is like the growth of your nails. It helps with your eye. Vitamin D helps with your eyesight, helps with your teeth, your bones. And not only that, it helps with your immune system. So if a big indicator of your overall health is how often are you getting sick? If you or you know someone who gets sick often, that basically means that their health is not in the best condition right now, or their overall health is not really that great if they get sick a lot. Because your immune system is supposed to be strong enough to fight outside invaders and not get sick so often. So how do you get vitamin D, optimal vitamin D levels? Obviously, you can get it from your diet, but it's really impossible to get adequate amounts from your diet. So the number one thing you should focus on to get vitamin D is sun exposure. I know some people out there, they live, I'm lucky to be in Southern California, so I get sun almost all year round. But if you don't get sun all year round, you really want to pay attention to the seasons where you do have sun. So what I would recommend is when the sun's out, you would go out for 20 to 40 minutes a day. And the best time of day to do it is around 11 p.m. to 2 p.m. 11 a.m. to 2 p.m. This is where the sun's the highest. You're going to get the most beneficial rays. And experts, they recommend you get around 4,000 IUs per day, international units per day. So 20 to 40 minutes a day is going to easily net you 5,000 to 10,000 IUs. And for the people who don't live in, Southern California where it's sunny all the time, vitamin D, your body actually stores it. I believe it stores it in the fat cells. So when the season is sunny, you want to get as much sun as you can, so you have the reserves for when it's gloomy. I have some people who they live in Washington, and man, it's gloomy. I don't know how many months out of the season, but I know when the sun's out, it's beautiful. They go out, they get their vitamin D, and that is enough to have some reserves for the gloomy days. So what are optimal levels of vitamin D? So if you take I believe it's called a 25 vitamin D blood test, you want to get around 40 nanograms per milliliter to 60 nanograms per milliliter. That's optimal levels. I know online you might see levels like, 20 is sufficient, 20 nanograms per milliliter to 50 nanograms per milliliter is sufficient, but I think this is optimal here, 40 to 60. Now, if you're under 12 nanograms per milliliter, that's a deficiency of vitamin D. You really want to get your vitamin D up if it's at that level. So of course, you could do it by sun exposure. You can get some in your diet. Vitamin D3, you're going to get it from animal foods, fatty fish, egg yolks. And vitamin D2 is going to be the plant form, which you'll find I think mushrooms are probably the highest in plant vitamin D. Or you can supplement with it. Personally, I did have supplements in the past, vitamin D, but I don't really do it that often anymore. I think the sun is the most powerful way to get it. But if you live in a place where there's not much sun, you want to supplement it. And the recommended dose is 2,000 IUs per day, maybe some more. It all depends on what your certain situation is. And another thing is, today's age, where a lot of people are scared of the sun. Yes, if you get too much sun, that's not healthy for you. You do increase your risk of skin cancer if you do too much sun. And when you're talking about too much sun, you're talking about when you go outside and your skin burns. You don't want to get to there. You only want to get enough sun exposure. We're talking about 20, 40 minutes a day, where about half the time it will take you for your skin to burn. So here's a controversial subject. Sunscreen. Should you be using sunscreen? Well, most sunscreens, they block UVA rays. Okay, so, they don't block UVA rays. UVA rays will increase your risk of melanoma. But sunscreen, what sunscreen does, most of them do, they block UVB rays. UVB makes your skin burn. So by having sunscreen, you don't block UVA, which increases your risk of melanoma, but you block the UVB, which burns your skin, which tells you to get out of the sun. So I do not recommend sunscreen. I never put on sunscreen. You just don't want to be in the sun out where you're going to be burning. And if you are, I would recommend go long sleeve. Go long sleeve, cover your skin. That's the best way to have some sunblock. I would not add on sunscreen. Okay, so that's the video for vitamin D. Again, it's a precursor hormone, regulates normal growth of cells. To get sun exposure, you want to do large areas of skin, naked. So you go out in the sun, you take your shirt off, wear them short shorts, get as much skin contact with the sun as possible. And you just want to go 20 to 40 minutes a day. 24 minutes a day, around 11 p.m. to 11 a.m. to 2 p.m. That's going to get you the most beneficial rays, okay? And you need cholesterol to synthesize vitamin D. So your body does synthesize its own cholesterol, but I would get it from your diet. Cholesterol foods, animal foods, okay, egg yolks. That's gonna help you create more vitamin D. So that's the video for today. I appreciate you guys watching. Peace out.